The NHS-Galleri trial is a study to see if a simple blood test can help us to find more cancers earlier than we currently find them. We know that finding cancer early means that we can then offer more curative treatment options to patients.
Current NHS screening programmes only pick up about 6% of all cancers, and that's because there are only screening programmes for cervical, breast, colorectal and lung cancer more recently.
So the test that we used in the trial is called the Galleri test. It's a multi-cancer early detection test.
This is one of the largest screening trials in history. It's a trial of enormous magnitude and scientific importance, testing whether this multi-cancer early detection test works in a real-world clinical setting. There were 142,000 participants between the age of 50 and 77, representing, roughly speaking, the population of England and diverse socioeconomic backgrounds.
They were asked to provide 3 blood samples over 2 years. So we used mobile clinics. The clinics were set up in 150 different places. So we very much wanted to take screening to people and out into the community.
This trial is a randomised control trial, which means that we have 2 groups of people, one of which has the screening test and the other doesn't, and then we compare the results of those 2 groups.
So half of them, 70,000 people, we tested those samples. As soon as anyone had a positive test, they were referred to the NHS, and then the NHS investigated that and treated it if there was cancer that needed treating. And in the other arm, we just stored the blood samples so that we can look at them in the future. So when we set up a trial, we set ourselves a goal. And the goal here was to reduce the number of people who got stage 3 and stage 4 cancer over a 3.5-year period. We didn't meet that goal, but we saw a lot of other things which are really positive.
We saw a substantial reduction in stage 4 diagnosis, and that was a 20% reduction after the first year.
The chances of survival with stage 3 cancers are significantly higher than the chances of long-term survival with a stage 4 cancer.
We found a 16% increase in the number of cancers diagnosed at stages 1 and 2, and this includes cancer types like ovarian cancer, pancreatic cancer, and liver cancer, where we often find them only at the most advanced stage.
We detected 4 times more cancers with the multi-cancer early detection test compared to the NHS screening alone.
Another exciting finding was that there were a quarter fewer people who had their cancer diagnosed after presenting in accident and emergency with something major. And it's not good news if that's the way your cancer is diagnosed. And so the fact that we reduced that by so much is very promising.
Reducing emergency presentations is a key goal in cancer early detection.
This test is accurate, and very, very few people who don't have cancer have a positive test result.
And in the future, we'll be reporting further results on longer-term follow-up from our data, and we're reporting the cost-effectiveness of the intervention, of the test, and we'll be reporting on the psychological impacts of having the test and receiving a cancer diagnosis through screening.
In a few years' time, the researchers will also look at whether using the test could help reduce cancer deaths. I'm really excited by the results here. We really have shown that there's an opportunity to make a really substantial difference in finding cancers earlier when we can offer treatment options to patients.
I think the UK and the NHS can be phenomenally proud of what they've achieved. It recruited in record time. I think the quality of the data is outstanding and gave us outcome data in a real-world clinical setting. It's a phenomenal achievement.
Trials like this used to take 15 years. We've done it in 4 years.
And the results demonstrate that there is a clear future for this kind of test.
So I'm really grateful to the 142,000 participants for their time and effort in attending the clinics 3 times.
Without them volunteering, we wouldn't learn how to make a better screening program in the future. So if anyone's listening, thank you very much.
Based on a clinical study of people ages 50 to 79, around 1% are expected to receive a cancer signal detected result, which includes predicted cancer signal origin. After diagnostic evaluation, around 62% of these people are expected to have a confirmed cancer diagnosis. The Galleri test is prescription only. The Galleri test is recommended for use in adults with an elevated risk for cancer, such as those age 50 or older. It is not recommended for individuals who are pregnant, 21 years or younger, or undergoing active cancer treatment. Galleri should be used in addition to routine cancer screening. Galleri does not detect a signal for all cancers. False positive and false negative results do occur.